Well, a warm welcome to today's talk. It's Wednesday, the 12th of April. Now, firstly today, I'd like to apologise for the removal of yesterday's video from the channel. It's not what I wanted, it's not what you wanted, but it's the situation. I can't really go into details about what yesterday's video was about. We'll just say it was about a 14-year-old girl from Japan, so apologies for that. Now, today's video is quite sensitive, really. It's about the BBC journalist Lisa Shaw, who tragically died. Now, I and ahed about including this report, but I decided, seeing the material was in the public domain, as I will show you, and the importance of getting away from statistics and looking at individuals merited that I should put this on. And I'm gonna make the video. I may decide not to post it or not. Well, I've been umming and ahhing about it all day, but let me just show you what this is about. BBC journalist Lisa Shaw had a first vaccine, AstraZeneca vaccine, in May 2021. Now, the recent report from the BBC says she died a week later. The earlier reports say it was 3 weeks later after the vaccine. Tragically aged 44. Now, let's just look at a brief news report from the time and the verdict of the coroner at the time. Let's just look at that now briefly.
The family of BBC Radio Newcastle presenter Lisa Shaw say she died after suffering blood clots just over a week after receiving the AstraZeneca vaccine. The 44-year-old from County Durham died last Friday.
The statements released in the last hour says she fell seriously ill after having the vaccine. Our correspondent Helen Carnell is with us now. Helen, what more have Lisa's family said?
Well, relatives have said that Lisa developed severe headaches a week after receiving the AstraZeneca vaccine and then became severely ill a few days later. She died at Newcastle's RVI last Friday afternoon, having been treated in intensive care for blood clots and bleeding. Now, the BBC is reporting that it's seen an interim fact of death certificate, which lists the vaccine as one of the possible factors being considered.
Good afternoon. A coroner has concluded the BBC Radio Newcastle presenter Lisa Shaw died after complications of the AstraZeneca COVID vaccination. Lisa, who was 44, died in May, 3 weeks after being given her first dose of the vaccine. Well, our news correspondent Mark Denton was at the inquest at Newcastle Civic Centre this morning and joins us now. Mark.
Well, Jeff, the inquest heard that Lisa initially developed severe headaches at home. She was treated first in hospital in Durham and she was then transferred to the Royal Victoria Infirmary in Newcastle, where she sadly died. Now, in her conclusion, the senior Newcastle coroner, Karen Dilks, said it was clearly established that Lisa's death was due to a vaccine-induced thrombotic cytopenia. Now, that is a condition which leads to blood clots and swelling of the brain. The coroner said it was a very rare condition. Now, earlier in evidence to the inquest, we heard from Dr. Christopher Johnson. He was one of the doctors that treated Lisa in hospital in Newcastle. He said it was one of the first cases he'd seen where the underlying cause of a condition was, in his view, a complication of the AstraZeneca vaccine. Now, a pathologist who examined Lisa, Dr. Talmo Pavakovsky, he told the inquest that he supported strongly the idea that her condition was vaccine-induced.
Now,
Maybe look at that second part of the interview later. So that was the contemporary news reports and the verdict of the coroner. So pretty unambiguous there, the coroner and two supporting doctors, including a pathologist, agreeing, sadly, with that diagnosis. Now, coroner ruled that sadly Lisa died from vaccine-induced thrombotic thrombocytopenia, so the blood clots and the low platelets. Now, I want to give some words to this to Mr. Gareth Eve, who is the widower of Lisa. And some of the things he says are really quite moving, of course, but really quite poignant, questions that need to be answered. He said he's reached out, attempted to engage with the government, MPs and 3 prime ministers. I'll leave you to work out who they are. it's not in my makeup to turn around and say I want to sue someone for almost 2 years. We've tried to engage with government and tried to engage with MPs since Lisa died, and not one of them has reached out or engaged with us at all. I'm reminded of the mass walkout from the Houses of Commons on the 2 occasions that we've played speeches from Mr. Andrew Bridgen and also from other MPs that have tried to critique healthcare policy. They've just been met by empty chambers. Some might think disrespectfully. So why aren't the politicians engaging with this? Any engagement is fleeting at best, so that's the reason we're left with no alternative, sadly, according to Mr. Eve. If the government or AstraZeneca don't want to engage with us, then what else are we supposed to do? These things have happened to too many people, and we're made to feel like it's a dirty secret that we're talking about something we shouldn't be talking about. It's established it's being caused by AstraZeneca COVID vaccination. It's not about COVID. It's not about how many lives the COVID vaccines have saved. It's about what this vaccination did to Lisa and other families, and not about how successful it was or whether someone is anti-vax. And Mr. Eve's requests are really pretty modest, and it amounts to just a recognition. A recognition is what it is asking for. A direct quotes again from Mr. Eve. Some sort of acknowledgement or recognition that these deaths have occurred. Just we want politicians to say, yeah, these deaths have occurred. But he's been met with a wall of silence. We're not crackpots or conspiracy theorists. Mr. Eve says he's not a crackpot or a conspiracy theorist, and I agree with him. We're husbands and wives and family members who have lost someone. That's all it is. Whatever the money, it's not going to bring back my son's man back. Now, of course, the vaccine producers were, I think the AstraZeneca did, certainly the Oxford, the Pfizer and the Moderna ones. They were very careful to get themselves indemnified. But there seems to be a bit of a loophole here in the Consumer Protection Act. So this is Mr. Eve's legal representation, Solicitor Peter Todd. Under the Consumer Protection Act. Now, I'm not going to get into the law. I'm just quoting what they say. I know nothing, or essentially nothing about the law of the Consumer Protection Act. But he's saying the vaccine was a defective product, that it was not as safe as consumers generally were reasonably entitled to expect. So interesting pursuit under the Consumer Protection Act. Department of Health and Social Care, of course, have come back. The Vaccine Damage Payment Scheme provides financial support to help ease the burden of individuals who have, in extremely rare circumstances, they say, been severely disabled or died due to receiving a government-recommended vaccine. AstraZeneca reported to the BBC. And, of course, one gets the impression that this is only on the BBC. Probably completely wrong, of course, but because it was a BBC reporter. Let's hope that's not the case, that the BBC will be equally concerned for any citizen of the country. But nevertheless, this is the individual tragedy of many individual tragedies that is being reported. We're unable to comment on ongoing legal matters. Of course, AstraZeneca say, fair enough. Patient safety is our high prize priority, and regulator authorities have clear and stringent standards to ensure that all safe use of medications, including vaccines. Our sympathy goes out to anyone who has reported health problems. Evidence shows the vaccine had an acceptable, not exactly reassuring, is it? An acceptable, bit of backpedaling there perhaps, safety profile. The benefits outweigh the risk of extremely rare potential side effects. Well, now, to be quite honest, I don't think that they do, but this is now, maybe that was then, but this is from a recent report. So, interesting developments to come there. Are we about to get some government acknowledgement or government recognition? Really wouldn't hold your breath on that. And it's just tragic to transpose statistics into individual cases, and this is as heartbreaking as many of the comments and emails that I've received. Let's just give Mr. Shaw a little bit of time at the end of this video now. I think that's probably the respectful thing to do.
Appreciate those numbers, those figures will be absolutely zero consolation to you and to your little boy. Mm-hmm. But you want to speak about what happened to Lisa.
Yeah. Those numbers that you talk about there are staggering, incredible. What the vaccine has done is unbelievable. And as I say, Lisa and I both queued up to get our jabs and had no qualms about doing that, and like I say, we're very positive about it. And as I say, the work that these people have done to get the country back on its feet is outstanding. But we need to recognise that there are families who've been affected by this jab. You know, I've seen numbers that have been taken from the government's own yellow card system. You know, a reputable doctor has pulled this information out that suggests that the number of fatalities is approaching 1,500 people. And
now, to be fair, at that point, there was some counter argument from the interviewer there, presumably in some way. Let's say she works for the BBC. But I'm not going to go into the argument now. This is really about the personal experience. So back to Mr. Eve.
But it hasn't been a drop in the ocean for our family. It's hit our family. My mother-in-law, my father-in-law, sisters-in-law. It's hit us like a tidal wave. We don't even know whether Lisa, as a statistic, features in the yellow card system. Lisa's death certificate is currently an interim death certificate that does state the AstraZeneca vaccine on it as a cause of death. There's an inquest, but I don't know whether Lisa appears as a statistic until that is concluded. I don't know. The coroner has told me and my family that they don't believe that the cause of death will change. He said it's highly unlikely. There's nothing to suggest that it would change. But as I say, I think those numbers need to be looked into. I just feel as if these people need to be talked about.
Okay. And you have shown me the interim fact of death certificate. It talks about irreversible brain injury, it talks about hemorrhage and swelling of the brain, and it talks about complication of AstraZeneca COVID-19 virus vaccination.
Yeah.
I'd like to read a statement from the Department of Health, Gareth, if I may. The government say vaccines are safe and effective. All vaccines being used in the UK have undergone robust clinical trials and have met the Medicines and Healthcare Products Regulatory Agency's strict standards of safety, effectiveness and quality. I want to ask you finally, Gareth, how would you like Lisa to be remembered?
Lisa was always smiling. Lisa was so kind. She was my best friend. She was a fantastic mummy and daughter and sister. And she was an excellent broadcaster. She'd do anything for anybody. And she was just doing the right thing. That's all she was doing. And I just don't want what's happened to her to be brushed under the carpet. If anything good can come of what's happened to Lisa, so this doesn't happen to other people. We sat there in the intensive care unit and we saw what they did to my beautiful wife to try and save her. I don't want that to happen to other people. I don't want anybody else to have to tell their children that their mummy's not coming home. So as I say, if she can be remembered in that way, that, you know, she's done some good, that would be positive.
Gareth, I am so sorry.
We need transparency, we need truth, we need openness, so we can have an independent scientific analysis of what has gone on. And we need to learn lessons. And at the moment, quite frankly, I don't think we are. We'll leave it there for now. Thank you for watching.